Good morning, everybody. Dr. Z here for this week's episode of Tooth Teacher Tuesday. Today, answering a question, kind of following up on a topic that we discussed a few weeks ago, as far as we were talking about TMJ disorders and how a lot of TMJ disorders and tooth grinding, teeth breaking, stuff like that, all in the grand scheme of things, typically ties back to sleep apnea. So, you know, today's topic, the question we're answering is how does sleep apnea tie into dentistry? Um, and again, we've touched on this a bit, but basically with sleep apnea, as I think most people know, is typically caused by during the night when we're sleeping, our airway starts to collapse. We're not able to get enough airway through, and snoring is a common symptom of that, where the airway's kind of vibrating, and to the point where with severe sleep apnea, we're not getting enough air through, you stop breathing, which is obviously a scary thing. If you've ever witnessed somebody do that in their sleep, it's pretty startling. Um, so, our airway, obviously we've got our nose that is a big part of our airway, um, and typically most healthcare professionals would say that normal breathing, especially at night, is going to be through our nose. But if our airway is obstructed in any way, um, that's when you're going to start seeing mouth breathing, just because it's a bigger opening, more room for air to get through. And again, that's just kind of our body's natural way of trying to compensate for an obstructed airway, um, by just doing anything we can to get air into our system. And as we mentioned a couple weeks ago, you know, in that effort to open our airway up as much as possible, we our jaws start to shift around, and that's where a lot of nighttime clenching and grinding and that muscle tenderness and tension is going to come into play. Um, so, and when you think about sleep apnea, I think most of us are familiar with the typical first line of treatment is going to be a CPAP machine, which is basically just a fancy machine that's bypassing your airway to get air into your lungs. So it's not treating the actual source of the problem. It's not opening the airway. It's just treating the symptom by forcing air in there. And obviously CPAPs are effective for a lot of people, but I would also say probably 50-50. When people talk about their sleep apnea, about half of people say that they can't use their CPAP. It's just uncomfortable sleeping with that thing in, and there's a lot of upkeep as far as keeping the machinery clean so that you're not getting bacteria buildup in the CPAP machine that would cause all sorts of respiratory diseases. So CPAP is it's obviously an effective treatment. It's just not the easiest thing to comply with when you're in that position. Um, so that's where a lot of people wonder, what are my other options for treating my sleep apnea? And um, again, treating more the source of the problem, the collapsed airway, versus just treating the symptoms, is where a lot of your other options are going to come into play. So one option would be to basically remove excess tissue that's obstructing your airway. Typically that's going to involve removing tissue with the tonsils, or in the nasal cavity. Um, yeah, those are going to be your typical treatments. Another thing with airway collapsing at night that causes that obstructive sleep apnea, a lot of times our tongues come into play. Our tongue kind of falls to the back of our mouth as we're laying back, and that's what closes off our airway. So, sometimes with people that have more of a tongue tie, that they have that band under their tongue that's kind of restricting the movement of their tongue, sometimes we'll release that band a little bit to basically give the tongue a little bit more movement so that it can, in your sleep, kind of be positioned more forward and open up the airway as well. Now that's a procedure that, and a lot of this is something that, a sleep doctor is going to be diagnosing and prescribing a treatment. We as dentists, we have a role in this if we're recruited by a sleep doctor, but a lot of this, certainly CPAP is not something a dentist can do. These tissue laserings, that is something that dentists, oral surgeons are allowed to do under our license. Not many of us do that, but that is something. And then there's obviously other surgeons out there that can do this as well. But the main role that dentists play when it comes to treating sleep apnea is making a nighttime appliance that instead of like night guards that we've talked about in the past that cushion our teeth against clenching and grinding forces, making a nighttime appliance that essentially opens up the airway by sliding our bottom jaw forward. By doing that, again, when you think when you're laying back and sleeping at night, your bottom jaw is going to have a tendency, gravity is going to push it backwards, and your tongue is going to go with it, and that's going to kind of seal off your airway. So an appliance like this is going to basically force your bottom jaw forward, which admittedly doesn't sound like the most natural thing, but by sliding the jaw forward, it creates more opening for that airway. And so there again, we're treating the problem instead of just treating the symptoms. So that's essentially how dentistry plays a role in sleep apnea. Again, in order for us to even be involved in this, you're typically going to need a sleep study with your sleep doctor to determine if you're a good candidate, if sleep apnea is truly your diagnosis or if there's something else going on. But yeah, that is something that is becoming a very much emerging area, not only in dentistry but in healthcare in general. I think that it's probably the most underdiagnosed and undertreated medical condition, at least in the United States, if not the world. And again, sleep apnea, when you're stopping breathing at night, you're not getting good quality rest to heal and to recharge your brain for the next day. And so sleep apnea is linked to all sorts of health conditions, high blood pressure, high blood sugar, and I'm sure more to come that we'll find as more and more research comes out. So certainly something that I feel like is going to become a growing part of our health care field in the coming years, that instead of treating high blood pressure or high blood sugar with medications, again, we go to the source of the problem, help people get better night's sleep so that they don't develop these conditions in the first place, and then we can cut out the medications altogether. So again, very, very important condition that can't emphasize enough the importance of, if you're diagnosed with sleep apnea, doing something about it, because treating your sleep apnea is going to be life-changing. So anyway, that's my little, I'll get off my soapbox about that, but yeah, very, very promising stuff coming in the future as far as just revolutionizing our healthcare system by treating sleep apnea. So hope you found all this interesting, and as always, if you have any questions or comments, please leave them below. I'm happy to answer those. But otherwise, till next time, have a great week and be well.